A modern neurosurgical service is provided in most of the places, but it mostly consists of well-trained surgeon, a decent operation theatre, a decent intensive care unit, wards, and that's all. What is special about a modern neurosurgical services in Apollo? That we have added technology which is available anywhere in the world right at our doorstep. Right from the place of diagnostic, but more than diagnostic, we have brought that technology to operation theatre. And after a very good intensive care and ward outcome, we have also added the last destination, which is very important destination for patient before they get discharged, is Neuro Rehabilitation, where rehabilitation for both brain and spine is done for the patient, so that the final outcome is not only satisfactory, but it is good. The modern technological advances which we have especially added in our system is intra-operative MRI scan, which is also there present in few places, which is very helpful in navigating the brain during the course of operation. And as we are operating, we can do MRI scan and decide the course of action. But also some other interesting navigating tools such as OARM and robotics in the spine. Apollo Hospital is probably the only place where all these three things are available in the private sector in this country. All regular operating equipment such as microscope, high-end operating table, various micro instruments, various kind of endoscopic systems, CUSA, neurophysiological monitoring to monitor the functions of the nerves. They are present. They are also present in lots of places, but the combination of everything is unique to Apollo Hospital, Hyderabad. High-end equipment in neurosurgery means intraoperative MRI scan, which has a very wide use but very costly tool. It can be intraoperative CT scan, intraoperative ultrasound, various kind of monitoring, various kind of spinal navigation tool like robotic and OARM. Now, we are very lucky that the combination of practically every high-end equipment, which I told you once again to repeat, intraoperative MRI scan for brain, OARM and robotics for spine, neurophysiological monitoring system to monitor the brain and the spine as well as the nerve function, precision guided microsurgical instruments, various kind of complex endoscopic systems for both brain and spine is very unique to this place. We are equipped, we have a very well equipped brain suite as well as a very well equipped spine suite. And practically everything which can make your surgery safer, but not only safer, but radical and safer is available in this setup in Apollo Hospital, Hyderabad. Intra-operative MRI scan. We know that the most important tool for diagnosis of a brain or a spine lesion is MRI scan, and it is available in now small district towns also it is available. But there a patient comes, goes, but having that MRI scan inside the operation theatre is very challenging, because MRI, as we know, is a very strong magnet. So we have to create a very safe operating environment. But the advantage of having this MRI scan, which is dedicated to operation theatre, that every now and then, and also for some very elective cases such as pituitary tumor, skull-based tumor, glioma of certain locations, even some spinal tumors of difficult location, we would like to know during the middle of the operation, are we done? How much is left? Are we in the right place? Because it will be really bad if the patient where we have planned to do a certain procedure to a certain limit and we have not done the optimum. And why we have not done the optimum? Because we have lost track during the operation. Where is the optimum limit? Because the optimum limit shifts. Intraoperative MRI scan actually brings the diagnostic to the operation table where the patient is under anesthesia with the skull and the brain or spine open and we want to know exactly where we are, have we done our job, and we can use the navigating tool. These navigating tools are linked to MRI scan, and we can do then and there, and then within 15 minutes we can reorient, we can reset our goals and achieve the best possible result. It is a costly system. As a result, it is available in only few centers in the country. We are one of them. We have a very special kind of MRI scan. Generally, you would have seen that MRI scan, you enter through one tunnel. But this MRI scan is very interesting. It has got two tunnels. You can enter from either end. So there is one tunnel especially dedicated to the operating surgeon, and patient is very comfortable, and I think it adds a lot to the quality of neurosurgical operation. Now, we know that in spine, in today's world, the highest growth of, if any surgery has taken place, is in spine surgery. And a lot of spinal instrumentations have come where we put screws, nuts, we go to the precise location. We know that 2 mm this side we have a spinal cord, 2 mm other side we have a nerve, and damage to any of these can actually put the patient on the bed forever. So we need to be very precise. Till now, the tool for that was what we call X-ray, a special type of X-ray called fluoroscopy. But in a complex procedure, the number of X-rays which we took was phenomenal, and it gave us only a two-dimensional image. It did not give us any idea about the three-dimension. We had navigation, but that also was limited by the X-ray itself. Now, OAM is almost a combination of CT scan versus three-dimensional fluoroscopy. So you actually take cuts of the spine with the navigation tool fixed, and by precision we can go to a millimeter, less than a millimeter error to wherever we feel like in the spine. As a result, spine surgery becomes much safer as far as the procedure goes, and the amount of radiation to the operating surgeons, nurses, patient as well as the anesthetist decreases considerably. We can also see at the end of surgery our results. We add 5 minutes extra and we will know exactly where we are, what we have done, is everything is all right, and then we will wake up the patient. So again, it makes the surgery safer, and we can do more complex procedure in today's world without feeling very scared about what we are doing and what will happen. Here we talked of OARM. Now, spinal robotic is slightly different from OARM. Spinal robotic, of course, is based on artificial intelligence, and the data from the spine surgery, wherever area of spine we do, is fed to the computer, and the computer actually can see the shifts of the bone. So from that respect, it is slightly different, that OARM will give you image when the OARM is done, but robotics can actually judge the shift in the spine and auto create. So for a minimally invasive surgery, robotic is another tool which gives us a precise location of where to do. Unlike robotics in the abdomen, these robotics are the guidance robotics. They are not the operating robotics. So they give you guidance, whether to what depth, what angle, where do you have to go, and all these things make the operation very easy. Of course, technology comes with a price, but Apollo Hyderabad is the only center in the country to have both robotic and OARM in the private sector. Neurosurgical, we have talked about a good diagnosis, because a diagnosis gives you an idea beforehand what you plan to do. We have talked about good role of surgeons, nurses, ICU staff. We have talked of an average operation theatre, and we have talked of high-end operating theatre, which we are fortunate to have. But all these things mean that we are going to operate more and more difficult cases, and these cases will require rehabilitation. So in cases where rehabilitation is required, And earlier we were not able to do all these cases. We had too much of problems with these cases, and one was not willing to go to that depth and to that limit. Now with a very good modern neuro rehabilitation, we are able to do much more and get a patient from average outcome to a much better outcome. We know that road traffic accident, we know that stroke are the two commonest causes of disease in the earning group of population, that is a middle income, middle age. Both road traffic accident and stroke affects that area quite a lot, and the whole family suffers. But with a good neuro rehabilitation, apart from a good early treatment, a modern care, you can also, in spite of coming with a deficit, can go out with a very good outcome and may even join your previous work. So it is very great for a patient from patient's perspective. Apollo has a very good outpatient as well as 50-bedded neuro rehabilitation center with robotics in it. So there is a robotic mobility also training can be done there. You may do a good job in a very critical case. What differentiates a very good outcome from a outcome totally depending upon luck is a very good intensive care, because sick patients require good intensive care, 24/7 doctor nurses care. Not only care, knowing when the problem is going to come and predicting it and taking care of beforehand. So today's modern neurosurgery has changed a lot in last 20 years because of intensive care, and it is an ever evolving field where more and more trained staff are coming, and we have a much better care. We can do much more difficult surgery because we can go that extra distance because of the backup. Neuro rehabilitation is probably single most service which allows a patient to get back to normal function or as close to normal function. It has got multiple components. It can be a simple home-based neuro rehabilitation, it can be an outpatient-based neuro rehabilitation, or it can be an inpatient intensive neuro rehabilitation. There, we know that a sick patient loses the muscle tone. Patients who are paralyzed, they do not know how to use their remaining good muscles, how to shift from the bed to the toilet. Is a simple activity which we don't think about, can make a huge difference in a paralyzed patient if they themselves can sit up on the bed, move themselves on the wheelchair, go to the toilet, sit on the toilet, finish their ablution, come back and lie down. Not only the person has become semi-independent, it has freed one family member to do the work and earn the living. So neuro rehabilitation is very, very important for both short-term and long-term. Apollo has been a pioneer in it. We have a very modern neuro rehabilitation center, both inpatient as well as an outpatient, and most of our patients love going there if they have any such disability. We also have a system, due to some reason if they cannot go to these places, we train them, and if they are in a position, then we can also sometime organize rehabilitation at home, because we are also backed by one Apollo care after discharge. So we have a team of nurses, physiotherapists who actually make home visit. Apollo Home Care has been a pioneer in home care. These are trained nurses, they are trained physiotherapists, and the people who, due to some reason, would like to be in their place but still would like to avail services, that also is available.